Welcome everyone today. Thank you for coming. Just a couple of housekeeping bits and pieces first. So just to let everyone know that the meeting is being recorded and live broadcast. We haven't got anyone in the gallery other than the press gallery, so there's no need to do that bit. But just say, obviously, for evacuation purposes, we're not expecting any fire alarms, so if any do go off, please leave by the fire exits, and then we muster up next to Queen Victoria statue in the Guildhall Square. So I'll just move through the agenda now. So we have apologies for absence. I understand there's apologies from Councillor Luke Stubbs, and I have no declarations of interest. So just move on to item 3 on the agenda, citizens' intervention into substance misuse, and I'm going to hand over to, I think, Alan, or Jason is going to if you can just introduce yourself, Jason.
Yeah.
Thank you very much.
So Jason Halsey, Director of Public Health for Southampton and Portsmouth, and I'm going to do a quick 2-second introduction of Alan probably. But yeah, so this is some work that we did using the Vanguard Systems Thinking intervention, sponsored by the council, looking at the drug and alcohol service that we provide through our fantastic providers in Society of St James, and the work was done mainly because we really wanted to make sure that the focus on meeting user needs was being met, and that we wanted to improve our responsiveness to user need, I guess. And I'll hand over to Alan from there, I think.
Alan Noble, Development Manager within the Public Health team, and I'll just introduce Anna Jackson, Service Manager for Society of St James, and Mike Taylor, Director from Society of St James. So briefly, in terms of the report that we brought, it's an update on the progress that's been made over the last year around substance misuse services in the city, and specifically looking at the Recovery Hub, which is the main gateway entry point. There was a small team from the Society of St James working with one of our Portsmouth City Council interventionists following the Vanguard Systems Thinking methodology. And the way that the methodology works, there's essentially 3 stages to it. There's a check phase where the system, the model, the service delivery is studied and observed, so that we can determine how effective and efficient it is. And then that moves on to redesign, where you experiment with alternative ways of working, testing them in real time to see whether they work. And the elements that do work, you then look to roll in, which is to scale them up and then normalise it as normal practice. So in terms of the work that was done by Anna and her staff and our interventionist at Portsmouth City Council, we went through the check phase. The first thing was determining a purpose, and the purpose that the team developed for the service was, from the customer's perspective, was to help me make my life better. And then the team went and observed various aspects of provision, and it studied the demand that came into the service. And from the systems thinking methodology, there's 2 types of demand: value demand and failure demand. And value demand is work that's that it meets the service users' needs, and failure demand is something that arises when something hasn't gone quite right and there's a call from the service user. Actually, it was reasonably encouraging when they did that the value demand, 81% of the work was value work, and 19% was failure demand, but that does still mean that 1 in 5 inquiries or issued demands was as a result of something not going right the first time. And there's issues that came up through the response of the service, or the way the service was working. So it showed that contact to assessment times, the time that someone first contacted the service to the point they were assessed, there was really probably an unacceptable delay in that. At times, providing the prescription, we're a drug and alcohol service for drugs. Often the prescription of the methadone or similar is quite key for a drug user, getting them engaged and on that quite quickly. and that there was delays there. And they looked at appointments, and 91% of the appointments were at the request of the service, and only 9% by the client. So it showed something that Vanguard talks about: pull, not push. Respond to the client. Don't impose too much on the client of what you want to do from your processes and systems. It's all about trying to meet the need and delivering value work that directly delivers the purpose of the service, which is to make someone's life better. In terms of some of the issues, again, the conditions, or what they call system conditions within Vanguard that were identified, there was fragmentation. So a start-stop process. Someone came in, they were told to come back on an assessment day. They came back on an assessment day, they were triaged, they were then allocated to a worker who then contacted them to do a comprehensive assessment. And as you can see, going on, there's stages in the process that make it quite fragmented and built in delays. In terms of authority levels, there was processes where workers had to go to managers to for fairly straightforward routine decisions, I guess, that was creating delays. And there was duplication and rework within the process. So in terms of that was the check phase. In terms of the redesign phase, the team worked actively with live cases on a different way of working, and they tried different things. So for example, with the assessments, they allow people to walk in, engage with them, and took on their case from day one. And there was essentially stopped doing the triage and the full assessment process and just went to a more narrative assessment with a client, which was much more focused on what their needs are and focused on helping them meet their needs, and not necessarily meeting our needs for all of the data that we wanted to capture. That led to some really positive feedback and improvements, and instead of someone maybe waiting on average 18 days, there were cases where someone walked into the service, was assessed, and walked out with a prescription after an hour and a half. So significant improvements for the client experience. In terms of we then looked to roll that out, and the service has now moved from a process of having 2 assessment days, Tuesdays and Thursdays, where people were directed to attend those days, to now a 5-day-a-week assessment process where people can drop in and be assessed. It's likely that the worker that's there will be the person that picks them up, and the work starts at that point rather than the delays and processes that we had built into the system beforehand. And Anna can talk more about the service user experience and the feedback. But from our experience, we've got much more availability of service provision. We've got probably around 100 extra people in treatment now than we had beforehand. And certainly the feedback I'm getting is it's a much more positive experience for the staff and for the service users.
Thank you, Anna. Sorry, Alan. Anna, did you want to add anything?
I think the thing that the most important thing for me is the management thinking. That part of the Vanguard method for systems thinking is that leadership thinking, the choices that we make as managers, are directly responsible for the design of the system and are directly responsible for the client experience. And what we learnt in the intensive months that we were studying this method was that we had to start thinking differently as managers, and we had to design some measures which were aiming to help us to actually help us better understand the service that we were delivering, with the aim of improving it, not just to collect data for data's sake. So I think the challenge for us as managers was to kind of be aware of our part in the system design and be aware of the importance of us thinking in a different way and getting into the work. So we now have a team of managers who are in the work, who are seeing it live, who are seeing the customers come through the door, who are seeing the new style of working, who are asking questions in line with the Vanguard principles, so that we are embedding the principles in the staff. we went through a rigorous, we call it EDIP, the training programme that we use to staff members are trained on a one-to-one basis, and we show them how to do it, we demonstrate, we watch them use the new method, and when we're both confident that they're ready to go live with it, they go live with it. So we've got, as managers, far more idea of the quality of the work that we're delivering, and far more contact with our staff and with the service users. So it's, for me, it's the key thing for this is the leadership thinking and making sure that we embed those principles and stay in the work.
Brilliant, thank you. And did you have anything to add? No, brilliant. I'm really pleased. It sounds like such a positive positive experience all round, and I've had experience in my day job with working with clients of mine who've accessed both under the old system and under the new system, and I certainly concur that from an outside point of view that the system works is a lot more user friendly now, and I know that the process did seem a lot more sensible after the systems thinking approach and the Vanguard approach than before. So can I just ask, going back to yourself, Alan, sort of has there been any particular cost implication by this, either positive or negative?
There's been no cost implication to the changes and the work that we've done. That was something that we set out at the beginning because there had been very significant savings over a period of time from substance misuse services prior to this. We did say to the staff that this wouldn't be used as an opportunity to cut the service further, but it was an opportunity to get more bang for our buck, so to speak, and to make a more effective, efficient service. So no, in terms of cost implications, it hasn't cost us anything more or less, but what it has done is created additional capacity, which has allowed us to take on some of the additional service users that we'd probably lost in the previous years because of the reductions in service provision.
Thank you. And yeah, and I think that's probably the most positive thing out of this is the fact we've got 100 extra people who are accessing the services, and we know it's not just the case of it's helping them in that area, but it's also about everything else. You know, that someone who is accessing drug and alcohol services is having an enormous amount of impact on being able to live their life in a much better way, and just in things in general. And of course, it stops other on costs from and having to access other services, because if they're not in treatment, then a lot of other things are going to be going wrong, and there's going to be more intervention needed. So I'm really pleased. I'd like to thank SSJ for Society St James for taking part in this, because I know for other organisations and the councils running it, it can be a bit difficult sometimes, and it's a bit of a leap in the dark many times as well. So it's really good to see. I'm really pleased it's been so positive, and I really hope this can just continue into the future. But as such, I'm really happy to note the reports, and thank you everyone for coming. Thank you.